The straight leg raise is an excellent exercise to strengthen the quadricep muscles, especially in three cases or some combination of them. Number one, if the patient's pain is very severe or irritable. Number two, if the patient is not permitted to weight bear on the given lower extremity. And number three, if the patient can only move through a small range of motion at the knee joint. But before you teach a straight leg raise exercise, the patient should probably understand a quad set, which is a very useful exercise for activating the quad muscle. Now, the quad set is not just a simple contraction of the quadricep femoris muscle. A correct quad set requires dorsiflexion of the ankle, and that dorsiflexion should be held throughout the duration of the quadriceps contraction. So you'll see that right here. So step one is dorsiflexion of the ankle, which you see right there. Then I contract my quadriceps, and I'm going to maintain that contraction for around 10 seconds. Once I've held that contraction for 10 seconds, I can then relax and reset like you see right there. And a typical rest period might be 10 seconds. So 10 seconds contracted, 10 seconds off. So there I'm dorsiflexing my ankle and contracting the quadriceps right there. And you'll notice for that full 10 seconds, not only am I maintaining quadriceps contraction, I'm also maintaining ankle dorsiflexion. But before you teach a straight leg raise, the patient really should know how to do a quad set. Once they understand that, you can progress to teaching the straight leg raise exercise. Now, the straight leg raise exercise is different than the straight leg raise test used to rule down a lumbar radiculopathy. The straight leg raise test is passive, meaning the practitioner passively moves the patient's leg up. The straight leg raise exercise involves the patient using their own muscles. Now, while the quad set only utilizes the quad muscles right here because it's an isometric exercise, the straight leg raise exercise is also going to use the iliopsoas muscle group, psoas major and iliacus, in addition to the quadriceps. And the straight leg raise exercise is done exactly the same way as the quad set, except instead of being isometric, we're also going to raise the leg up. So let's take a look at that right here. So here I am in the supine position. I'm going to start by dorsiflexing that ankle, contracting the quads, and holding both of those. I'm going to elevate the thigh at the hip joint. In other words, hip flexion. That's the straight leg raise. And I'm going to hold it there for a number of seconds. And then I'm going to slowly lower the thigh back down to the table while I'm maintaining dorsiflexion and quad contraction. In other words, knee extension. So there's dorsiflexion, quad contraction, and I raise it up. The entire time that leg is in the air, I am maintaining that quad contraction and ankle dorsiflexion. Once I bring that back to the table or the ground, I can then relax and reset. Again, the straight leg raise exercise is done exactly the same as the quad set. Ankle dorsiflexion, quadricep contraction, except now you're raising the leg up. And because you're raising the leg up, you're utilizing the hip flexors. The rectus femoris is the only quad muscle that is a hip flexor, but again, we're also utilizing some of iliacus and psoas major, the iliopsoas muscle group. However, the entirety of the quadriceps are also used because they are contracting to draw that patella up towards the hip, that superior glide force on the patella. So again, the straight leg raise exercise is a progression of the quad set and works the quadriceps even more than the quad set alone. Then we can progress the straight leg raise to a seated straight leg raise exercise. This is done exactly the same way, ankle dorsiflexion, quad contraction, and then while maintaining both of those, we elevate the thigh at the hip joint. In other words, hip flexion or the straight leg raise. And as long as the thigh is in the air, dorsiflexion and quad contraction are maintained. Now the benefit of doing this form of the exercise, as opposed to the normal straight leg raise in supine, is that this form goes through a larger range of motion at the hip joint. Theoretically, my hip right here could start out with the thigh at vertical, okay, if the table was a little bit higher. And so I could go from vertical basically to horizontal, with the thigh and leg horizontal or parallel to the ground. So this allows me to cover a larger range of motion. Also, as we approach the thigh being parallel to the ground, gravitational torque is increasing, meaning as you're going up, the exercise is actually getting more difficult. Now with the supine straight leg raise here and the seated one on the next slide, you can progress both of them by having the patient do it against TheraBand resistance, or you could even have an ankle weight around the ankle to provide more resistance against which the quads, particularly the rectus femoris and the hip flexors, have to move against.